Hi, my name is Dr. Jason Smith. I'm a chiropractic physician here in Bountiful, Utah. I've been in practice for the past 27 years, and over the past 15 years, I've been working on treating patients through functional neurology, also known as functional neuroscience. And I have been using the VNG oculomotor system in my practice with patients for about 15 years. About 5 or 6 years ago, I heard about Dr. Hatch and his COGNURO oculomotor assessment system and balance system, and I jumped right on it. We started using it in our practice on every brain injury and balance and neuropathy case, and we've had great results. So first I want to tell you how it's benefited my patients and the clinical results. First of all, it's helped me identify the issues with patients faster. Second, it's been really good for patient engagement. They see their dysfunction, they're validated when they realize that they have a problem that many other doctors couldn't find. They've been told so much in the conventional medical system that they're crazy, that they don't have anything wrong, their imaging doesn't show. And what we found with the COGNURO system, we can identify specifically those issues that are not normal. And the third, it's just made them see the before and after, and it's been great. It's sped up my clinical results. It's really helped patients when they get confused about what they should do first, what they should do second, and they just get engaged. They want to have those eye movement tests improve. It's also helped me have measurable improvements, before and afters, intermediate re-exams to show that things are improving. And almost always the patient feels better, sometimes even before these eye movement tests and balance tests improve. This system has helped me with many different aspects with my professional relationships with other medical professionals, depositions, and brain injury cases that I've seen where there's third parties involved, insurance companies, attorneys, and even in court. With the system, I can localize and pinpoint exactly what brain regions are involved in these brain injuries, and then it helps me localize the functional deficits. I've been able to get objective data that really complements and supports my clinical examination in the neurology arena. It's just strengthened my position, and it's given me more confidence when I'm working with patients. There are complex brain injury and brain dysfunction cases that we see, but often they're told from insurance companies that their other providers can't document a dysfunction, and so they're literally being turned away. And some of them have even been accused of insurance fraud. So this says, look, I look at this test and I can show that this is, some of these eye movement tests, they're impossible to fake. You can't fake the dysfunction because they're so accurate. So I think the patients have really been happy to see that they have validation that they're injured when they really are. And in a few cases I've seen when the patients have been malingering and just seeking more attention, and I've been able to tell them, no, you are solid in all these different brain regions. I also really love the equipment. It's very functional. It's so easy to use. Most of the time, my staff just does the test, and the patients, they're able to do it in just a few minutes. It's reliable. The iPad system is stable, and it's very clinically valuable. I love that Dr. Hatch and his team, they're constantly updating and making improvements to the system. They take our advice and they say, we can have a recommendation. They really implement those things. Their programmers are brilliant. I don't even know how they were able to do so much to make this work as well as it does. And every time we update it, we have new tools that help the patients even more. The last thing I wanted to share, just a quick success story. I had a patient who had fallen about 20 feet and had a facial fracture. She ended up needing reconstructive surgery on her face. And after she had reconstructive surgery, her facial surgeon said, you look great, things are great. And she said, but I can't think, I can't focus, I can't talk, I can't go back to work as a teacher. And he said, well, there's not really much else we can do for you. Your face looks perfect. So I met her a few weeks later, and this patient was blown away by what I was able to find from this COGNURO system. The doctor was telling her that there's really nothing else he can do. She'd had her facial reconstruction. She should be happy that she looks beautiful again, but she couldn't function as a teacher. She couldn't take care of her family. She couldn't tolerate conversations or family gatherings. She wasn't sleeping well. She was dizzy, just numerous symptoms. And she was referred to me by another practitioner. And as I did this brief test on her, within less than 10 minutes, I knew she had a brainstem injury. I knew she had a cerebellar injury and a frontal lobe injury. And if you see just how rough it was just for her to even watch a target go back and forth, it was sad. Like, she couldn't even have a consistent interview with me. She was basically having her husband say everything. So we did this test. I gave her a couple simple eye movement exercises to do 2 to 3 times a day. And what happened was, in just a few weeks of her doing those a couple times a day, she was able to have significant change in about 2 or 3 weeks. So you can see, as you look at the eyes, how much clearer her eyes are, how much more accurately they track. It was just brilliant, because now she was on her way to recovery. Didn't mean she was ready to go back to work. It took a few more months to get everything dialed in, but she was thinking, hey, I might have hope. And to me, that's what this system is about. It's about precision, about not diagnosing and labeling patients, but giving them specific dysfunctions that they can work on. And when they work on those things, they are reinforced and motivated to work on them more. Her breathing changed, her balance changed, her eye movement, her speech. She was able to get back to work, take care of her family, and I'm just really excited for this patient and so many hundreds of others just like her that have been able to benefit from the COGNURO system. I do want to talk a little bit about Dr. Hatch and his role. He has such a big heart. He loves the practitioners. He loves his patients. He's still practicing every day, and he just wants to help people recover faster from brain injury that's destroying their life. I'm really impressed by his vision, his leadership, and his team, and what he's done to make this system so dynamic. It's really helped me make a bigger impact on my patients, and I'm just grateful for COGNURO. I'm grateful for Dr. Hatch and all of his team. So thank you, Dr. Hatch. Thanks, Dr. Hatch's team, the COGNURO team. You guys are amazing. Thank you so much for allowing me to be part of it and to be able to have my patients benefit from your amazing system. Thank you.